Thank you, Madam Chair. At this time, I think Finance summed it up, and we're happy to answer any questions you have.
Okay, thank you. We'll go on to the next panelist representing CDE.
Good morning, Deborah Brown with the State Superintendent of Public Instruction, Tom Torlakson. And I'll provide hopefully a little bit more background on the CCDBG and where we're at with that process. So I'll try to maybe preempt some of the questions, but happy to answer more. So the Child Care Development Block Grant is the federal source of funding for many of California's subsidized care programs, and the Child Care and Development Fund is a component of the block grant. And that's really an aggregate of several funding sources that's distributed as a block grant by the federal government to states and territories. And the purpose of the Child Care Development Fund is to increase the availability, affordability, and quality of child care services. And the Department of Education is designated in state law to be the lead agency responsible for administering the fund in California. And so going back a little bit, in 2014, in November 2014, the president signed the reauthorization of the block grant. And with the reauthorization came the new template and the requirement for states to respond to it, and this is called the preprint. And the final preprint was released in December of 2015. Given that there are a number of new changes included in the reauthorization, the department has held 3 public hearing and input sessions to gather feedback on how to aspects of the state plan. And so the hearings took place over the course of last year. And they were based on a draft plan that we developed in January of 2015. And then on March 2016, following that feedback and some revisions, the department submitted the 2016 to 2018 state plan that included the consultation with the legislature, the Department of Finance, the LAO, the Office of Social Service, Department of Social Services, and other relevant state agencies, as well as input from advocates, stakeholders, contractors, providers, parents, and members of the tribal CCDF and members of the public. And so that's posted online. So the components of the state plan, there's a total of 8 sections, and of those, so there are specific sections that ask for significant changes and consideration. And there are also sections that the Department of Education and Department of Social Services asked for and received the most feedback on. And so that's Section 3, which is stable child care financial assistance for families, Section 4, equal access for high quality child care for low income children, and Section 5, standards and monitoring processes to ensure the health and safety of child care settings. In order to address the changes required by the reauthorization, the new state plan submitted by the department included the following changes. And so this was including increased consultation on the development of the state plan, consumer and provider education information, protection for working parents, improving access for homeless children and families, family contribution to payment, accessing market rates and child care cost, health and safety trainings, to name a few. The Federal Office of Child Care is also in the process of promulgating regulations, and we expect those in the summer. The Department of Ed provided comments on the draft regulations in a joint letter with the California Department of Social Services. And when the state submitted the plan, there were several areas where we knew we weren't prepared to respond to. And so that was when we, at the time we submitted the plan, we also submitted a waiver letter. And so under the direction of the Federal Office of Child Care, the components of a complete state plan included implementation plans for sections where the state was unable to fully implement specific requirements, and a waiver in the form of a letter was required if these were not going to be met by the effective date. And so the department requested waivers for one of 2 reasons, either because the department lacked the authority to implement the changes or to ask for additional time to meet the implementation deadlines. And so that waiver request again was submitted with the state plan last month. And the areas for which we requested a waiver, those included the statewide child care disaster plan, coordination with other partners to increase access to developmental screenings, items related to protection for working parents, the graduated phase-out of assistance, fluctuations in earning, the 12-month eligibility, and prevention of disruption of work. There are others around annual monitoring, inspections, criminal background checks, training, and professional development. The department was recently notified that the state plan was returned incomplete. The feedback received from the Office of Child Care's Region 9 office was that the state plan lacked the complete implementation plans for which California requested a waiver. And the Region 9 also indicated that the entire state plan has not been reviewed yet. So they really just looked at the waiver letter and said that our approach to it was incomplete. The Federal Office of Child Care reported a total of 33 state plans submitting waiver requests, including California, and several state plans, 10, again, including California, were returned to be reviewed by the respective offices. The department is currently working in collaboration with the Department of Social Services and consulting with the legislature and administration to revise and resubmit the plan. The revised plan, again, will be posted on our website. And in reference, as Ms. Holmes said, it's unclear what the sanctions will be, and they potentially include withholding the administrative services portion of the state allocation. And understandably, the department is regularly asked to provide cost estimates for priorities for implementation for various components. And although there are a number of new requirements within the reauthorized block grant, and the department feels the following 3 areas should be prioritized for implementation by the legislature. And some of these will be familiar because the first 2 are part of the aligned with the Women's Caucus proposal. And so that's a 12-month eligibility requirement, utilizing the most recent regional market ceilings, and then there's also annual monitoring inspections for license and license-exempt providers. So again, the 12-month eligibility aligns with the Women's Caucus budget request, and the department is waiting the adoption of the final regulations to understand exactly how and if California's current policies align with federal law. And assuming no additional investments are made to subsidize childcare, the only possible cost would be to CalWORKs stages 2 and 3. And the department is currently working to provide an estimate to the increase in caseload and costs to the stages. For the utilizing the most recent regional market ceilings, or providing an estimate to this change is particularly challenging. The department does not collect child and provider-specific reimbursement information, so estimates are highly challenging to calculate. A rough estimate, though, does hover in the range of several $100 million, and then the annual monitoring inspections for license and license-exempt providers. And the related cost estimates for that monitoring, we'd have to defer to the Department of Social Services. Related costs for the annual monitoring of the license-exempt providers, there are a few factors that would have to be considered. The department is committed to promulgating Title V regulations to comply with the reauthorization of the block grant once the state budget is finalized and the federal regulations have been adopted. The department looks forward to future conversations with this committee related to the implementation activities required of the block grant. And with me, I have Debbie McManus, who's the Director of Early Education and Support Division, who can help answer any questions.
Thank you. Why don't we complete the rest of the panel, then we'll open it up for questions of the entire panel. So McManus, you're just going to wait to see. Okay, great. Let's move on to Pat Leary from Social Services.
Thank you, Madam Chair and members. Pat Leary from Department of Social Services. We're here to answer any of the licensing questions or the RMR concerns that you may have. The department has been working very closely with the Department of Education as we have been responding to the federal requirements and the proposed regulations at the federal level, including providing them feedback on areas where California may have met or exceeded their standards. For example, as mentioned in the background check requirements, we believe that California already meets or exceeds the requirements in the federal block grant. So we've provided them that input as well as some information about, there are smaller pieces of the grant that require things like the posting of inspection reports for license-exempt providers to the extent that those providers are individuals who are only taking care of one child in addition to their own. California already prohibits us from posting exemption reports on small family home child cares. There was a concern a number of years ago with privacy and security safety for these individuals that are caring for children in their homes. And so as a result, we on our department website post the information about the name of the facility, but we don't provide any information about the location of the facility.
Could you very briefly respond to her point about cost projections for annual licensing visits?
Yes, and as she described it, it's a complex. Each are complex. We worked last year as well, because the question came up last year as we were talking about this as well, and estimated that to add the license, to go to an annual inspection for licensed child care providers, remember that we are going to a 3-year inspection, was around a $20 million cost estimate to take that to that level. And for license exempt, it's a very, very complex. We are still working on that number.
Right. But 20 million to go to annual from what we currently do.
Yes, in that neighborhood.
Got it. Anything else? All right, and Ms. Johnson?
Good morning, Kim Johnson, Department of Social Services, also available for any questions that you might have.
Great, thank you. Questions of committee members? Senator Morlock.
Thank you, Madam Chair. Just one quick question. You all have the staff report that we received, and so on page 2 we get a chart, and I've been tearing this thing apart, so maybe staff could meet with me afterwards, but I'm trying to figure out how the 573 million or whatever it will be, 583 million for this year, how does that fit in with this chart, stage 1 or child care? I'm an accountant, so I like to crossfoot and try and put it all together. So I'm just wondering, Ms. Holmes of the Department of Finance, Inc., if you understand this chart and how I could maybe grasp it a little better.
Certainly, Senator Morlock, and I'm happy to send some information to your staff if you would like as well. The CCDBG funds that we have, they go to a variety of programs, and in some ways they fund slots, and in some ways they fund quality. So CCDBG funds are used very similarly to general fund in our AP program, our capped voucher program.
I don't need to give me a whole background. I'm just like, what's stage 1? What's stage 2? I mean, we're talking about a rocket ship, or what?
Well, I will.
Maybe it's just maybe a recommendation to staff to kind of fill it in a little bit better, so I know how it correlates.
And if your question is a kind of a definition of terms of what's on this chart, maybe CDE could help you with that.
Because on the chart, Madam Chair, the only number that correlates to anything and to the issues that we were discussing is the proposed block grant number near the bottom. And so the other issues 2 through 5, you don't see a correlation to all the other numbers. And I'm referring to page 2 on the dollar amounts.
I got that, but if you flip to page 3, you'll see the definition and the description of each of those terms. So you'll see that
those are, okay, so for the definition of the stages, but then it goes to like slots versus dollars. So, you lose me.
I got you. So in terms of understanding what the programs are, there's a description.
Right. And then the dollar allocated to those programs would be the thing I'm missing. So that's just a tip, or just to humor an accountant. That's all I'm asking.
And what I heard your kind of 10,000-foot level question to be is, of the federal CCDBG 577 million, was it, dollars?
Right. How does it fit in with those?
What does it pay for on your chart on page 2?
Right.
On your chart, the numbers that you're seeing are a combination of TANF, CCDBG, and general fund. In stage 1, the majority of funding is TANF funding. There's a little bit of general fund in there. In stage 2, and I'll slow down if I'm going too fast. Stage 2, it's mostly general fund with about $10 million of TANF. Stage 3 is a mixture of general fund and CCDBG. General child care, again, a mixture of general fund and CCDBG. Alternative payment is the same as general child care in stage 3, mix of general fund and CCDBG. All of our preschool age programs are Proposition 98 general fund with no federal funding.
Right.
Okay.
Great.
So you see, it's not.
No, I know it's intertwined. I
blended.
just want to try and crossfit. So thank you, Madam Chair.
Mr. Block.
Thank you, Madam Chair. Question with regard to the annual monitoring inspections. I mean, I think for a lot of reasons, monitoring is a good thing. But for some of the exempt providers, I would assume it's a very different kind of monitoring if there's going to be monitoring at all. Could you explain that to me? And also, are we able to meet that federal requirement? I guess we do just once every 3 years in some cases now, or most cases, so.
For our licensed, Pat Leary from Department of Social Services, for our licensed providers, we had been at a once every 5 years plus a random sampling of 30% of the providers every year. In last year's budget, the legislature adopted a plan to ramp up those so that they will be once every 3 years for childcare beginning in 2017. The CCDBG requirement to go to annual visits applies to both licensed and licensed exempt. The block grant language itself does not describe that it has to be identical, nor who needs to provide that oversight and monitoring. So what the department has been looking at is if the legislature were to adopt a proposal that had the department providing that license exempt oversight, it would likely look very different than the rest of our licensing and oversight. Remember that our licensed child cares are businesses. Even the small family homes are intended, even though it might operate in your own home, it's intended as a business to provide child care. The licensed exempt, particularly when it's one family, just caring for the family, the children of one other family, is a very different situation. It's 40% of those are family members that aren't even subject to the annual monitoring. And in those cases, it's not being run as a business. It's really done more as a service to the other person with a little tiny bit of remuneration in addition to that. So we are looking at, and that's the difficulty we're having with putting together a cost estimate for it, is because it would look different. It would probably be much more like our technical assistance program, where we actually we don't go out on complaint, they don't do complaints. They don't go out and look for any kind of a follow-up on any concerns. What they do is they try and assist the providers in meeting their health and safety requirements for children. And that's the real intent, it appears to be. I should not speak to the federal intent, but it appears to be the intent of the federal reauthorization was to ensure that some minimum health and safety requirements were being met by those licensed exempt providers. So it would likely look really different than our existing how we monitor child cares. And so we are, as I mentioned, still developing the estimate for what that would look like. But again, that would just be one aspect. We are also, we've had conversations about what if there were others that could do this monitoring. So for example, it would not necessarily preclude another organization or entity to do that on-site monitoring for the license exempt care.
Okay, thank you.
I need to just back up a bit to more of a 10,000-foot level, and that's just, the process. So the federal government issues the CCDBG block grant, and there are changes. I'm not sure how we as a state who relies, as Senator Morlock helped us identify, pretty significantly on those federal dollars, can be in a position to submit a plan that we know doesn't meet the mark. I understand the waiver process, which is basically our process by which we ask to be excused from a requirement. But what's the process? So are we basically saying as a state that we do not intend to adhere to some of the elements of CCDBG? And then what is the plan that finance and the department is going to bring to the legislature so we're clear as a budget making entity what your proposed actions will cost us financially and in terms of quality. I think the whole focus of CCDBG is to improve and increase quality. And so it feels to me rather arbitrary, the aspects of the new block grant proposal that you have decided not to adhere to. So help me with the process.
Thank you. Deborah McManus, Department of Education. You're correct. We are kind of in a difficult point. I want to make one point very clear. We are not asking for waivers to opt out of those requirements.
Okay.
That's not allowed.
Okay.
We are asking for waivers to extend the timeline
Fair
by
enough.
which we meet those requirements.
And in the waiver itself, do you then suggest a timeline that you could meet? Or is it not structured that way?
We can only request up to 3 years.
Okay.
So we are requesting at most up to 3 years.
Okay.
And it is difficult because, as mentioned, the federal government is still promulgating their regulations. So we still have a lot of unanswered questions around what specifically they're asking for. There were a lot of new changes for the first time ever in this, what is a block grant, but really is very much more prescriptive than in the past. And so we are working with the federal government as we are developing our state plan and having to tell them how we're going to meet these requirements even before they've given us what those exact requirements are.
And would an example of that be the license exempt annual visits? We don't really know what their expectation of that. Would that be an example of lack of clarity around their vision?
Exactly.
Okay.
There will be more detail in the regulations. And for us as a state, we in California are unique in that we have a mixed delivery system.
Yes.
And we have a large license exempt population that we value.
Larger than any other state.
Exactly. So we need to think carefully about what does that visit look like, who's going to do it, how are we going to pay for it, those types of questions. And it's not something that can just be developed in 6 months and put into a state plan and send it, and here you go.
Couldn't agree with you more. Ms. Brown stated that there were instances when the department lacked authority to implement aspects of the block grant. That confused me since you have the responsibility to execute. Would those be examples of that, like require law change, so then you look to the legislature?
That's precisely it. So changes in law and then also budget appropriations as well. So for one, the regional market rate issue is a legislative and a budget change that's required.
And the regional market rate is set through the budget process. And so are you then looking to finance to determine whether or not they're going to adhere to CCDBG new regulations?
Yeah, this is why we're coming to you and asking for input from the legislature in terms of how we prioritize these. So that would be something that we would support doing and having the legislature do that through the budget process.
Okay, and so, and what's the process in terms of you coming to the legislature? Like you present now budget committee, and then is there a more formalized like meeting or a process where you as a department comes to, I don't know, either leadership, somebody, and says, this is what the feds are now asking us to do, this is what we need from you, this group or budget, this group is legislative? How does that work?
Well, and that's part of this here. So as we've had the conversations with the Department of Finance and legislative staff on that, so we're beginning that process now. So again, we were just notified of this just a few weeks ago.
I get it.
We've initiated that process by bringing this to staff at the different agencies.
Great. I just didn't understand kind of the workflow in terms of how it happens. We have a new block grant with new regulations. They're historic in terms of being much more prescriptive than they have been in the past. So I just didn't understand workflow and wanted to make sure that the legislature does have a role as opposed to the department administration kind of on your own, making decisions about what we will do and what we won't do as a state. So thank you. Any other questions? Senator Stone.
Thank you, Madam Chair. This is all kind of new for me as well, and I'm trying to learn a little bit of the history of the CCDBG grant process, and it's my understanding that they've never required us to inspect exempt providers. And I'm hearing today that we don't even have a grasp as to what's that's going to cost. Do we have an idea how many exempt licensees we have in the state of California in all the different stages?
So we don't have a precise number. We estimate that there are probably around 32,000 license exempt providers in the state of California who are serving subsidized children.
And collectively, how many inspections do we make a year in the state of California? contemporary?
For our licensed providers, we
Yes.
have approximately 47,000 licensed childcare facilities in the state.
47,000. So we're not doubling, but we're adding a significant workload to you. And the federal government, when they changed these provisions, did they provide any additional money to accommodate these inspections, or is it fair to say that we have a federal unfunded mandate placed upon us at the expense of childcare?
In our first response, when the reauthorization was first approved, our comments back to the federal government was that there was no funding provided for that and that the costs could be significant and was a concern. And we sent similar communication earlier this year to them indicating that we were looking to the federal government to provide adequate funding for these new requirements so that it wasn't coming at the expense of either CCDF funds themselves or state general fund for a federal requirement.
Well, I hope that in the end, after you get all your figures, I want to make sure that it's cost effective for us to take these federal funds and ultimately, provide enhanced services. I'm concerned that there's some variables there that could be large variables in comparison to the amount of money that we're getting. Are we spending, $400 million to get $170 million? And, it goes back to local government. Sometimes when you take federal money for federal highways, you got to jump through so many hoops, take so many years and so much expense that sometimes it's better if you can find alternative sources of paying for that infrastructure. I always like to take advantage of other pots of gold, coming from other governmental agencies. Of course, the federal government is the only one we can kind of go up and grab. But with all the strings that might be attached to that, is it really cost effective for us to pursue that? And I don't think you're prepared to answer that today, but I'm sure you'll keep an ongoing analysis because these exemptions, I think, are going to be very costly.
And I appreciate that that's one way of looking at it, Senator Stone. And another way of, and you're right, that is a new regulation from the feds, but another way of looking at it is that this legislature has asked for annual visits for quite some time. And there was a time when, if my recollection is accurate, where we did annual visits. So while this is a new federal ask, it's also something that the legislature has expressed a desire to do based on quality. It's not something that I recall the legislature's entertained ever with regard to exempt providers, but there's always a dialogue in the legislature about the quality of care provided by exempt providers, and lots of debate. Should we eliminate them? We certainly reimburse them at a much lower rate. So even in this instance where it feels like it's a federal mandate, that particular example is also something that the legislature has attempted to fund and put funding back in, because from our perspective, it's an issue of a quality measure. So I don't feel like that one in particular is a top-down unfunded mandate. It really is something that the legislature has expressed desire over the years to guarantee a level of quality, particularly in our subsidized, because many members always want to make sure that we're getting the best value for the invested dollar, and how do we measure quality if we're not going in those centers on a very consistent basis. So this is, for me, is a little different. Any other questions from members? Senator Morlock.
Thank you, Madam Chair. Maybe to follow up on something, and if I'm guilty of agenda drift, please forgive me, but we had a lot of testimony, and then we don't have counter discussion in the last round. And so, Ms. Holmes, a lot of the comments, or almost all of them, were directed to the governor's